Okay, let's begin. So today we're going to be discussing seizures in dogs. Now, cats can also get seizures, but my presentation today is about dogs. There is a lot of stuff that translates over to cats as well, with some slight differences, but ultimately, most of the information that we're going to be talking about today also applies to cats. Okay, so thank you for the introduction. I don't need to go over where I'm from again, but here you are. I am from Chicago originally, made my way progressively further north, then took a little detour all the way down south and back here in University of Minnesota, hopefully here permanently now. Been here since 2019. And today we will cover seizures in hopefully a very comprehensive presentation for you. I'll start by helping you learn how to identify a seizure. And really important is being able to tell if it's a seizure or if it's something else. Now, that as a pet owner is not your job per se, but you as a pet owner can help us in figuring out if your pet is having a seizure or if there is another condition affecting your pet, which may be treated differently. We will then go through the causes of seizures and how we as neurologists diagnose them. We'll then cover what constitutes emergency management for seizures. Then we'll go into long-term management, which is mainly medications. And finally, we'll go over some more details about at-home care for pets with seizures. So we'll go ahead and start by talking about how we identify a seizure compared to other conditions. So first and foremost, a seizure is defined as a paroxysmal synchronous discharge of a group of neurons. That's just a fancy way of saying that there's just too much brain activity going on all at the same time. Normally, your brain has little pockets of activity here or there. But when a seizure occurs, all the neurons essentially in the brain are active all at once. And that's just too much activity in the brain. And so what these illustrations are showing are what a normal brain looks like on a tracing called an electroencephalogram. That's a way for us to record brain waves, compared to a generalized seizure, where you can see as a result of all of that excess activity, we have all of this extra motion, busyness on that electroencephalogram tracing, just way too much activity. And if you have too much brain activity, the external manifestation of that is a seizure. And the reason that we see them is because if the brain is overactive, then the body is overactive. Your brain basically is powering your body in a sense. And so the result will then be excessive activity of the muscles. There are numerous different types of seizures, and there are also conditions that can mimic seizures. The first step in this is to observe seizures. Okay, so I'm going to show you some images or some videos, I should say, of dogs experiencing seizures. The second step is then for us to observe seizure mimics. So these are conditions that could be confused for seizures. I'm just going to warn you ahead of time that we are going to be watching some videos of dogs experiencing medical conditions. These videos are disturbing because these are people's beloved pets, and it's scary to watch a pet have a seizure. So if this is not something that you would like to watch, then I will alert you each time I'm starting and stopping a video, so you can look away if you do not want to watch a patient experiencing a seizure or the other conditions. So first off, a generalized seizure is the medical term that we prefer to use. Sometimes people will refer to generalized seizures as grand mal seizures, big bad, translated from French. I think it's confusing to use all these French terms, so I stick with generalized seizures because it's more descriptive. We're seeing seizures affecting the entire body. The most common time for animals to experience seizures is when they're resting. And the reason for that is because brains are actually their most active while we're sleeping. And so if they're already more active, then we have a lower threshold for which seizures can then grow on. And that's why a lot of times they seem to come out of the blue while a pet is sleeping. There are three components to a generalized seizure. One is loss of consciousness. And that means that they're essentially not responding to anything, either to sounds you may be making or to visual observations as well. They also then have body movements. And this can be in the form of paddling out their limbs, or being really stiff with their limbs stretched out. They also have a tendency to arch their necks. And the third component of a generalized seizure is that they lose bodily functions. This usually will come in the form of they might urinate during a seizure or defecate during a seizure. A lot of times there's a lot of saliva that's also coming out. And so for a generalized seizure, we're going to see all three of these components: loss of consciousness, body movements, and loss of bodily functions. I am going to go ahead and start one of these videos. And so I'm just going to alert you that I will be starting a video momentarily. I'm just going to mute this as well. So we'll go ahead and I'm going to show you a generalized seizure in a patient. So this dog is unresponsive and she's got these violent convulsions in her body. Her neck is arched. It's hard to see, but she's also been drooling quite a bit. Note that her limbs are very stiff. And that's something that we see very commonly during a seizure. I'm going to show you another video. And this dog is going to go into a seizure. So starts off with a little bit of some head shaking. And now she goes into a full generalized seizure. She's unconscious. She's paddling her limbs violently. And she's foaming a lot at the mouth. Again, can't see that because she's facing away from us. So these two videos are really good representatives of what generalized seizures look like. That video is over, by the way, for those of you who turned away. Next, we're going to talk about focal seizures. Focal seizures are sometimes called petit mal or petit mal, little bad seizures. And these can have activity limited to one side of the face or the whole face or one side of the body. These patients generally do not lose consciousness, and they may have drooling from one side. I'm going to go ahead and start one of these videos. So this is a focal facial seizure in a dog. Note that it looks like the dog's getting a locked jaw. And it looks like the dog is chewing, but she's not actively trying to chew. And then there's a lot of saliva falling out of her mouth. So this is a focal facial seizure. I've stopped that video. I'm going to start another video. This is a dog that's having another version of a focal facial seizure, twitching on the left side of his body. And we're ending that video now. Psychomotor seizures are hard to assess in dogs. They're essentially strange behavior that lasts for a few minutes. They might look like they're attacking an imaginary object, chasing their tail. They might have a change in awareness. We're not really sure whether or not these are real seizures in dogs. It's hard to tell because alternatively, these could be obsessive behaviors that dogs can also experience. To confirm that a patient is having this type of a seizure, you would need to do an electroencephalogram, an EEG, during an episode to see if they have abnormal brain activity. You could also do an MRI to look for structural brain disease, or you could do a treatment trial with an anti-seizure medication to see if the behavior goes away. But this is a patient who was reported to have a psychomotor seizure. And in this dog's case, it looks like obsessive spinning. And per the owners of this dog, during these events, they cannot get the dog's attention. So very different from the other seizures we see. So that's why we're just not sure if they're really seizures or not. I'm going to stop this video. We're going to move on. There are different phases to a seizure. And these are important because there are other conditions that don't have these phases. And so that's why it's useful to know about them. Okay, because other conditions that look like seizures will not have these phases per se. The pre-ictal period is the time prior to a seizure. This can be anywhere between several minutes to hours prior. and is manifested with abnormal behavior. They might vomit or drool as well. A lot of dogs also have no obvious preictal period. So seizure seems to come out of nowhere for those dogs. The ictal period is the seizure itself, and this is characterized by loss of consciousness, loss of their bodily functions, and those excessive body movements we saw. The ictal period, in most cases, only lasts a few minutes. They can go on for much longer, and when they do, that's life-threatening. But if it only lasts for a few minutes, then they will recover spontaneously without the aid of medications. The post-ictal period is the time after a seizure, and that can be up to hours following a seizure, and patients can continue to be abnormal afterwards, and they might vocalize, they might also be really clumsy, and they might be blind. The blindness is temporary. There are many conditions that can look like seizures, but they will lack seizure features and they will have other features. And it's very important to distinguish between seizures and other diseases because these other diseases have different underlying causes, they have different treatments, and they have different prognoses. Once again, I will warn you, we are about to watch some videos of dogs experiencing medical conditions. These videos may be disturbing, so I will alert you when I'm starting and stopping a video. The first seizure mimic I want to describe is syncope. Syncope is fainting, and this is usually due to a heart problem. So very different, not a brain problem, heart problem. The things that can make it look like a seizure are that the patients are unconscious. They might be laterally recumbent, meaning they are on their sides, and they might have some limb flailing. So could look like a seizure. What's inconsistent is that patients with syncope have no paddling or limb rigidity. It's associated with activity. So they'll be walking around and then they faint. They'll be playing and then they faint. They don't faint out of sleep, right? Like a seizure comes out when they're sleeping a lot of times. And these patients have a very quick recovery, so they don't have a post-ictal period. I'm going to go ahead and start this video. This is a dog experiencing a syncopal episode. So as you can see, he's just walking around minding his own business. And he gets a little winded, starts to stumble, and falls down. Now, one would think maybe this is a seizure because he's paddling his legs a little bit and his neck is arched. But he's much more still than a dog with a seizure. And after just a few moments, he's able to get back up, which is not what dogs do if they have seizures. They take a lot longer to recover in most cases. And within about 20 seconds, he's recovering, as if nothing ever happened. I'm going to stop this video. We'll move on to our next one. The next mimic is a vestibular episode. The vestibular system is the balance center, and a variety of conditions can lead to vestibular disease. And sometimes vestibular imbalance issues can be really severe, and they can be so severe that they look like they're having a seizure because they have such poor control and they're so off balance that they can be kind of on the ground, gator rolling in circles, and that can look like a seizure. They also have abnormal eye movements that can look like a seizure to some people. What's different, though, is that they don't lose consciousness. The episodes that they have can last for days to weeks, which a seizure doesn't last for days to weeks, and they don't have spastic limb movements. So this is just a little short video. Again, I'm letting you know I'm starting the video of this case, showing a dog with having a vestibular episode. Now he's not moving anywhere, so we can't see if he has any limb movements, but you can see his eye movements. And those are because he has a vestibular problem. He's not having a seizure. I'm going to stop the video. The next mimic to talk about is a movement disorder. And we see a lot of these. And I think that what we're learning is that there are a lot of dogs that historically were diagnosed as having seizures, which probably actually were having a movement disorder. And a movement disorder is a broad category of conditions that are characterized by atypical movements. Most of them, fortunately, are benign. Not all, but most are benign. So just have to ride out the episodes and they get better. I should say they are normal in between the episodes. They may never completely be without episodes. And sometimes they respond to anti-seizure medications. They are thought to look like seizures because they have repetitive body movements, but they don't lose consciousness. They have these limb movements that are rhythmic, but they're not rigid. And the episodes can last for hours, which a seizure cannot last for hours. If it does, patients succumb to their seizures. So I'll show you a couple of videos of patients with movement disorders. I'm starting the first video. And so you can see that this little Chihuahua keeps lifting up that right front leg. But she remains conscious. And this is the only thing she does. She keeps flailing that right front leg. I'm starting another video. It's the same with this little Cavalier. She looks stiff and she's holding up that leg, but she doesn't have paddling movements and she's conscious. So this is also a movement disorder, not a seizure. I'm stopping the video. We'll move on. Another mimic is a head tremor. And we see benign head tremors in many different dog breeds. They can either tremor in the yes direction or in the no direction. You might be able to stop these head tremors with a distraction, like holding a treat up to their nose. So to some people, they can look like seizures because they have these rhythmic head movements, but they don't have loss of consciousness. They don't have limb movements. They don't lose their bodily functions, and you can distract them out of it in many cases. I'm going to go ahead and show you this video of this dog with an idiopathic head tremor. Idiopathic means we don't know what causes it, but they're benign, and so there's no treatment necessary. So this is a benign head tremor in this Doberman. It is not a seizure. I'm stopping the video. We're going to move on. The final one I want to discuss are generalized tremors. And tremors can occur for a variety of different reasons. It can be from toxins, from degenerative diseases, meaning improper bodily functions that get worse over time. It can be from autoimmune conditions, or it can be because of a problem that the dog was born with. These can be confused for seizures because they have rhythmic muscle contractions. But what's inconsistent is that they don't lose consciousness, they don't lose their bodily functions, and depending on what is causing the tremors can last for hours to days, or they're permanent, depending on what is the underlying cause of the tremors. I'll go ahead and start this video for you of this dog. Now, this dog had tremors from eating a toxin that causes tremors. She made a complete full recovery. But not a seizure because she's upright, she's conscious. And so we would say this is a tremor syndrome and not seizures. I'm stopping the video. So for you to confirm that something is a generalized seizure, you need to see the tonic-clonic activity, right? So that's the bodily function, the bodily movements that they're doing, loss of consciousness, and loss of bodily functions. The post-ictal period will be there in some form, and it will last for at least a few minutes, right? So they're going to be abnormal following a seizure for at least a couple minutes, unlike a variety of these other conditions we've been observing. So here's something you can do. Really helpful for us is taking videos. And videos are so helpful now because they allow us to decide if it's a seizure or not and how serious it is. So here are my tips for taking good videos. Please, one, stay still, okay? Don't move around the dog. Like, we're not trying to get like cool angles and cool shots here. We just want you to stay stationary so that we don't get motion sickness watching your video, okay? Don't change from portrait to landscape or vice versa partway through filming. Keep your hands off of the patient. Show the whole dog. And if the file is too large to email, then upload it to YouTube. You can make it private, but that way you can upload much larger files. So with that, hopefully at this point you feel more comfortable with learning how to identify a seizure versus other conditions. So now what we're going to move on to is the causes of seizures and how we diagnose them. So seizures always occur due to excessive activity in the forebrain. The forebrain is the big meaty part of our brains, and it's made up of the cerebrum and the thalamus. And so in this diagram here, it's going to be this area here is the cerebrum and the thalamus. And this is the part of the brain that can cause seizures. Seizures always occur due to excessive activity in the forebrain. Okay? And there are a variety of different reasons, though, that seizures can occur, and they're broadly categorized as extracranial causes, Extracranial causes are diseases outside of the brain that lead to brain problems. Intracranial causes, which are diseases inside the brain, and epilepsy. So we're going to go through those one at a time. So the first thing I want to talk about is epilepsy, because it is by far and away the most common cause of seizures in dogs. In fact, it's the most common neurological disease seen in dogs. Most dogs that have epilepsy will develop it between 6 months to 6 years of age. However, there's a juvenile form of epilepsy affecting young puppies, and there's an old dog form of epilepsy called cryptogenic epilepsy affecting dogs over 6 years of age. So anyone can get epilepsies. Take home point. There are many overrepresented breeds shown here. However, epilepsy can occur in any dog breed. Epilepsy is inherited in some dog breeds. It's suspected to be inherited in others, but the exact gene has not been identified in those breeds. There's also a condition called reflex epilepsy, which is epilepsy that's triggered by events. Most common cause of reflex epilepsy, trips to the vet. Number 2 is to the groomer. Dogs with epilepsy are normal in between their seizures, and they have normal neurologic exams. Moving on, now we will talk about extracranial causes of seizures. Now, these are conditions outside of the brain that lead to changes in the brain. And what I'm showing you here are a variety of possibilities. So one cause that makes it onto the way for extracranial causes are the dog ingested something that it shouldn't. So these are toxins. So for example, got into some medication, either its own medication or someone else's. Coffee is another one, chocolate, right? Variety of plants can also cause seizures. And then sugar-free gum, which contains xylitol. And xylitol will cause pets to have extremely low blood sugar, which can lead to seizures. There are many other things that a pet can ingest to cause seizures, but these are some of the big important ones. Sometimes liver disease, if it's really severe, can cause seizures. And in really extreme rare cases, kidney disease can also cause seizures. Moving on to intracranial causes, these are diseases inside the brain that lead to the seizures. There are many different intracranial causes of seizures, and this little schematic just helps us think about some of those various causes. So one condition that can cause seizures is a brain tumor, and unfortunately that is a very common cause of seizures in dogs. Sometimes dogs can develop autoimmune conditions in their brain called encephalitis, and that can also cause seizures. Strokes can cause seizures in dogs. Brain malformations, like this here, this is hydrocephalus in this MRI, can also cause seizures. Various infections can cause seizures, and head trauma can also cause seizures. So how do we figure out what is the cause of a patient's seizures? Well, first and foremost, a veterinarian is going to obtain a thorough history from you. And that's where you are incredibly helpful. Has your pet had any exposure to toxins? Does your pet roam around some area, maybe rural or urban, unsupervised? Could he or she have gotten into something? Are there other illnesses that your pet is experiencing? Because sometimes there are diseases outside of the brain that can lead to seizures. Was there a recent injury? Have you traveled recently? These are all really important questions to ask or to have answered in a patient who's having seizures. The next thing that we'll do is we'll perform an exam, and we'll perform a full physical exam to look for extracranial causes of seizures. And then we'll do a neurologic exam. And that neurologic exam is really important in helping us decide, does this patient have a normal exam, which makes us think about some possible causes, or is this patient neurologically abnormal? And if so, can we make sense of that relative to the seizures? And then finally, after we've performed our exams, we'll perform diagnostic tests. And usually this comes in the form of some blood work. There are a variety of different blood works that we can do, but mainly we'll look at the red blood cell count, the white blood cell count, and then we'll look at liver and kidney function. There are a couple of other blood tests that we might recommend depending on what those initial blood tests show us. And then depending on what we are observing and what a client wants to do, we can then go forward and do an MRI of the brain and do cerebrospinal fluid analysis. Now, the MRI gives me a really beautiful picture of the brain itself, and the cerebrospinal fluid analysis allows me to microscopically evaluate the overall health of the brain. Alternatively, I will use time as a diagnostic test. And what that means is that I know that there are a variety of conditions that cause seizures. And if we leave those conditions untreated, or even if we treat them, eventually, if a patient has a primary reason for having seizures, other abnormalities will develop over time. As an alternative, if a patient is having seizures from epilepsy, that patient will remain completely normal in between its seizures for its entire life. And so if we have a patient who's been having seizures for years and is otherwise normal, it's very difficult to come up with another cause besides epilepsy for that patient. And that's why I say time can be a diagnostic test for us. So we have now covered the causes of seizures and how we diagnose them. So next we're going to move on to acute or emergency seizure treatment. So if your pet has a seizure at home, first of all, I know it's terrifying. I've been there. I want to assure you that it is harder on you than it is on them. They are unconscious, okay? I'm sure it doesn't feel great to have a seizure. It probably doesn't feel great to feel one coming on or to be coming out of it. But during the actual seizure, they are not experiencing it. They are unconscious. It's way harder on you than it is on them. Keep your hands off of them because they're not going to mean to do this, but their jaws are clamping open and shut, and it's very easy to get bitten in these circumstances. Film it if you can. Even if it's just 10, 15 seconds, get a quick video of it because it's really valuable for us to get to see what your pet is experiencing. And then contact your veterinarian and help them and have them help you decide what's the next best step for them. When is a seizure an emergency? A seizure that's an emergency is one that lasts longer than 5 minutes, or if they're having more than one seizure in 24 hours. And if either of these occurs, then you just need to bring your pet to a veterinarian. If it's after hours, you should be going to an emergency clinic. If it's during regular business hours, you should be going to your family veterinarian for these circumstances. Ideally, give them a heads up that you're on your way, just so that they can be prepared to evaluate your dog, but get your pet to a clinic. The reason why is because for seizures that last longer than 5 minutes, dogs can get really, really hot as a result of all of their muscles being active at once, and they can overheat to the point of causing organ failure. So it's important to get these patients hospitalized so that we can stop their seizures. If your patient or your dog has cluster seizures, meaning more than one seizure in 24 hours, most places are going to recommend, or at least offer, to hospitalize your dog. And the reason for that is that if your pet is having multiple seizures, then we want to try to intervene and stop your pet from having additional seizures. And so the reason for hospitalizing is so that we can start giving injectable medications to stop any additional seizures they're having. Also allows us to monitor them while we're starting their long-term medications. And then if you're at a specialty hospital and you want to know what's causing your dog's seizures, they're right there and we can prepare them for an MRI and a CSF tap. Ideally, we will keep these patients hospitalized until they're seizure-free for 24 hours. We want to be sending them home to you in the best shape possible so that hopefully you don't have to manage additional seizures in that immediate time period after they've been discharged, because we know it's stressful. Next up, we're going to talk about long-term management of seizures. And this is what most of seizure treatment is treating them long-term to try to prevent additional seizures. So the first question is, when do we start treating dogs with seizures? The general recommendation is that if a patient is having seizures as frequently as every 6 months, then we should be doing seizure treatment. Now, I will say that that's kind of a gray zone, because if your pet is experiencing, one seizure a year, I might argue that one seizure a year is probably an okay trade-off compared to medicating your dog. As opposed to the pet that's having a seizure every month, that's where we really stand to benefit from adding in medications. So there's a little bit of gray zone in terms of when we would start medications, but I would say certainly if your pet is having seizures every couple of months, we can do better for your pet by getting your pet on an anti-seizure medication to span longer time periods in between the seizures. If a patient has a seizure that lasts longer than 5 minutes, even if it's just their first one, they're a candidate for getting medication. The reason why is because if they're that good at having a seizure, then they're at risk for all of that overheating we talked about. So we want to try to prevent them from having additional seizures if we can, because they could be having life-threatening seizures. If your pet just has one seizure and that's it, call your veterinarian, let them know that your dog had a seizure. Most of the time, aside from running some blood work and doing an exam, most of the time we will just recommend that you monitor for additional seizures, because sometimes pets will have one seizure and then they'll never have another one. Depending on when the next seizure occurs, we'll start making the recommendations to start medication. Okay, so what do we have available? We currently have 4 options for you. I put a 5th one on there, but I will say I do not think it's effective. So the 4 options that we have are phenobarbital, potassium bromide, zonisamide, and levetiracetam. That last one, levetiracetam, is a mouthful. A lot of people just call it by its brand name, which is Keppra. Keppra and levetiracetam are the same thing. Pregabalin is entering the scene as well, but there are many studies that show that by itself it's not effective, and it's also not a great add-on drug. So I'm just putting it on there because you might be seeing it, but I do not recommend using it. So here's the thing. The perfect anti-seizure drug just doesn't exist. There are benefits and drawbacks to each of them, right? And unfortunately, the drugs that work the best also come with the most side effects. So we'll go through them one by one. The first one I want to talk about is phenobarbital. This is the most effective anticonvulsant we have for most dogs. Rarely, phenobarbital can cause liver and bone marrow issues. But if we do diligent monitoring, it's really uncommon that these become life-threatening. We just usually need to make modifications to their medications if they are observed. The side effects that we can see with phenobarbital are sedation and clumsiness in coordination. They often have increased thirst and therefore increased urination, and they have an increased appetite. These side effects are usually worst in the first couple of weeks of treatment and get better over time. But overall, definitely side effects that we see with this medication. Phenobarbital is my preferred starting medication because it is safe and effective. It's been given what's called a grade A as a recommendation as a first-line anti-seizure medication in dogs. So the college that I'm a member of as a diplomat recommends phenobarbital as the best medication available for most dogs with seizures. The nice thing about phenobarbital is that the dose can be adjusted over time, either up or down, depending on the needs of the patient. The next one to talk about is potassium bromide. This is nearly as effective as phenobarbital for most dogs. It doesn't cause any organ toxicities, which is good. So slight upper hand over phenobarbital. The side effects are the same. They can have sedation and incoordination. They can have increased thirst and urination, and they can have increased appetite. Again, usually worse in the first couple of weeks of starting treatment. I like potassium bromide. I don't like it as much as phenobarbital. And I will start with this medication if it's unsafe to start phenobarbital in patients that have liver disease. Patients with liver disease should not have phenobarbital. That being said, there are very few cases that actually cannot have phenobarbital. But if a patient cannot safely take pheno, then I will use potassium bromide instead. The one major downside to potassium bromide is that it takes a really, really long time to become effective. So there could be a couple of weeks while we're waiting for this medication to take effect, and the patient will continue to have seizures. The next one to talk about is zonisamide. This one is not as effective in most dogs compared to phenobarbital. It rarely can cause a kidney condition called renal tubular acidosis. I've only had 2 cases of that. I've met thousands of dogs on zonisamide at this point, so very uncommon. The side effects that we generally see are sedation and incoordination with this one. Although zonisamide has fewer side effects, it is less effective than phenobarbital, so it's not a drug that I prefer to start. Levetiracetam, or Keppra, is also not as effective in most dogs compared to phenobarbital. However, there are no reported toxicities. It can cause some sedation and incoordination. And although this medication has fewer side effects, it is less effective than pheno. So again, not a drug that I prefer to start. So which to start? So this is, I put this in and I mean it kind of jokingly to reference the Choose Your Own Adventure series, but that's really what it is. You know, phenobarbital and potassium bromide are more likely to work in most dogs, but they come with more side effects. Zonisamide and Keppra come with fewer side effects, but they're less likely to work. So you could go one or two ways, right? You could start with medication, excuse me, that seems more likely to work and deal with the side effects. Or you could try one that might not work in your dog And if it doesn't, move on to one that's more likely to work. A couple of other things to bring up, because a lot of people ask about these. CBD oil is safe to give alongside phenobarbital. There have been numerous studies at this point. And it might reduce seizure frequency when used with anticonvulsants. In terms of diets that have medium chain triglycerides, so things like NeuroCare, have variable results. Some report benefit, others report no benefit. So safe to give, also not sure that it really does much. Ketogenic diets have been shown to have no significant benefit in dogs, and they're also very difficult to create. It's hard to create a ketogenic diet for a dog. Elimination diets and gluten-free diets have also shown no significant benefit, and omega-3s also have shown no significant benefit. There's no evidence at this point that acupuncture helps for dogs with epilepsy. Now, there have been some flea and tick medications that have been associated with seizures. So if you're concerned, just speak to your veterinarian regarding what flea and tick medications are available for your dog. There are some that if your dog already has seizures, I would recommend against using those medications. Okay, we are going to finish up with talking some more about at-home management. So first things first, what can you do as a pet owner? One of the most important things you can do is give the medications as instructed. Ideally, give them on the schedule as best as you can. Some of these medications are given twice a day. Some are given 3 times a day, which is difficult. Excuse me. And potassium bromide can be given once a day. So that might also impact which drug you want to pick. We understand you have other things to do, right? You have busy lives, but as best as you can adhere to a schedule is one of the most useful things you can do. When your pet is left unattended, keep them in a safe area of the house. If you have a pool, don't let your pet have access to the pool when you're not home, right? Stairs might be something that you want to cordon off to keep your pet from falling down them in the event of a seizure. Recognize that if you have a dog that has seizures, they make and will likely continue to occur. Because once a brain starts to have seizures, it's essentially trained to have them. The goal is to make seizures as infrequent as possible, okay? And so that's the purpose of the medications. Sometimes that means no more seizures. A lot of times it means we see a reduction in seizures, but they still occur. Other important things for you to do, please keep a log of your dog's seizures. You should be noting the date of a seizure, the time, and the duration of a seizure. Contact your veterinarian if the seizures are becoming more frequent, more violent, or they're lasting longer. And the reason for that is because we might need to make adjustments. I think about seizure management as an art and kind of a trial and error condition. There are a lot of times where we need to make adjustments to medications on a case-by-case basis, and that's where the seizure log is really helpful. If your pet is starting to have seizures more than every 4 to 6 weeks, or is having more seizures that last longer, is starting to have cluster seizures, or you're experiencing really bad side effects from the medications, those are times to have a discussion with your veterinarian because there are likely adjustments that we can make. So if seizures are worsening, contact your veterinarian. They might recommend a drug level depending on what drug your patient's receiving, your dog's receiving. They might increase the current drug, or they might recommend adding in another medication. If your dog has multiple seizures in a day, contact your vet. They might recommend hospitalization, or they might recommend cluster buster medications, which are medications you can give at home to try to prevent additional seizures. If your clinic is closed, please bring your pet to an emergency room because seizures can sometimes be life-threatening if they occur in multitudes over a short period of time. So with that, we've covered a lot of territory today, and I just want to have some closing points for you. Seizures are common. They occur for a variety of reasons. Dogs that have epilepsy have a normal lifespan if their seizures are controlled. Dogs with other conditions causing their seizures will have a different prognosis based off of their disease. Most dogs with epilepsy are well controlled on one drug, but some dogs have drug-resistant epilepsy, which is where I come in, and I start managing the dogs that are on 2, 3, 4 medications to keep their seizures at bay. Your veterinarian is equipped to help you manage seizures. This is a common condition that veterinarians manage. They know what they're doing. You are an important partner in the care team for your pet. And what are your contributions? Your contributions to the care team, please take a video of the episode if you can. Discuss the treatment options that are provided. Administer medications on time as best as you can. Keep a detailed seizure log. Prepare other caretakers. What I mean here is you go out of town, you need to make sure that you have a plan in place for what happens if your dog has seizures. That also for me includes giving other people permission to make medical decisions for your pet in the event that you are not reachable. It's the worst thing in the world to be on vacation while your pet is sick. So you want to have a plan in place so that other people can help make decisions if you're not available. You're on a cruise and there's no reception on your cell, for example. And advocate for your pet. You are their voice. Make educated decisions on their behalf. Ask good questions. Don't be shy about asking your questions. We want to help you understand what's going on with your pets to make sure that we are all taking the best care of your pets possible. So I want to thank all of you for listening to my presentation today, and I am happy to take any questions at this time.
All right, thank you, Dr. Arnold, for this wonderful presentation. So now we'll begin the Q&A. We have a lot of questions pre-submitted and some that came in during the evening during your presentation, so let's jump right in.
Okay.
So first question for you is, are canine seizures and cat seizures closely related?
Okay, good question. So yes, they are. Cats can have epilepsy as well, although it's less common for cats to have epilepsy than it is dogs. And what that means is that a lot of times if a cat is having a seizure, more often than a dog, it could be from a primary problem causing the seizures, as opposed to a dog where epilepsy is usually the most common cause. But cats can also get epilepsy, and their seizures can look very much like dog seizures. Cat seizures can be really violent. It's a little distressing too, because cats climb up high. And so there's the added factor of they have a fall risk with seizures too, but otherwise very similar looking to dog seizures. Excuse me. Okay.
Thank you.
Next question.
This is a question. Are there any alternatives to phenobarbital treatment? Does this treatment plan shorten a dog's average lifespan? And the follow-up to that, is it common to have thyroid issues along with seizures? Sort of a multi-part question.
Sure. So the first part of that question is alternatives to phenobarbital. Those other three medications are certainly good alternatives to phenobarbital, at least to start with trying. Phenobarbital itself is very safe if it's monitored and is not associated with shortened lifespans in dogs. And finally, association of thyroid problems and seizures. No, thyroid problems do not cause seizures in dogs, and seizures do not cause thyroid problems. However, phenobarbital can interfere with our ability to interpret thyroid testing results. And so patients who are on phenobarbital can develop what looks like hypothyroidism, meaning low thyroid hormone production on their blood work, but they actually don't have the condition. It's just an interference of the phenobarbital with the testing.
Thank you.
Good question.
Another question we have for you is, can a dog live with mild seizures their whole life without medication? And if so, will it impact their longevity?
Okay, great question. It depends on what we would classify as mild. So if we think about a dog who has one seizure a year and it lasts a couple of minutes, I would say that no reason to treat that dog unless instead the seizure lasted 15 minutes, then I would say, oh, we should treat that dog. But if it's a mild seizure and we're defining a mild seizure as one seizure a year, a couple of minutes long, that will not be one that I would medicate, and it should not impact the longevity of your pet's life. It becomes a little bit more subjective, as we start to shorten the interval between seizures. I would say for me, if a pet is having seizures every 2 to 3 months, I would medicate that patient because I think that we can do better with medication for that pet. Either way, as long as the seizures are well controlled, it doesn't impact the longevity of the patient if their seizures are due to epilepsy.
Thank you. So another question for you we have is, can dogs go blind from seizures? Do they get brain damage from them?
Okay, good question. So dogs can become temporarily blind from seizures, but they don't become permanently blind unless they've had a really, really extreme seizure. But those pets will also have sustained a lot of other issues as well. And the next part of that question was, can they have brain damage from seizures? So the short answer is yes and no. It depends on how long the seizure is. If there is 30 minutes of continuous seizure activity, there is a high likelihood of permanent brain damage at that point. The good news is we very rarely have pets experience seizures that last that long. And that's the reason for bringing them in at the 5-minute mark, is because that way we can stop a seizure from lasting that long. Seizures that last only a couple of minutes don't cause perceivable brain damage. I'll put it that way. The reality is that we're not asking these dogs to drive cars or go to college or, so there's only so much that we can assess for their cognitive abilities. But the best that we can tell is that they remain their normal selves as long as their seizures are short.
Thank you. All right. Next question we have is, are there long-term effects of seizures? Second part would be, are there early warning signs owners should be watching out for if their dog hasn't had a seizure before?
Okay, so are there long-term effects of seizures? Fortunately, no, as long as they're short. No long-term effects that we can see in our pets. Are there signs to watch for? It depends on if you're talking, I guess it kind of depends on the time frame. So most dogs are very normal up until right before they have a seizure. And so leading up in the days to weeks leading up to a seizure, you likely won't see anything in your pet. What to watch for shortly prior to a seizure are some abnormal behaviors. So, and that's in that preictal period. And in that preictal period, some dogs will become really anxious. They might be clingier than normal, or maybe if they're normally a really cuddly dog, maybe all of a sudden they're not cuddly anymore. Some dogs will vomit right before a seizure, or they might have an accident in the house. So those are pretty standard signs that dogs are about to have a seizure. Now, if you have a pet who has seizures, you might get really clued into what your pet's preictal period looks like. And the benefit of that is that if you know a seizure is coming, then you can kind of prepare for it. However, there are other things to watch for that are not an indication of a seizure, but are an indication of a disease that can cause seizures. So, for example, if you have a dog who you're observing that the dog is consistently walking in circles in one direction and kind of seeming out of it, aimless pacing, right? Walking in circles in one direction consistently. So let's just say, for example, always walking to the left counterclockwise, right? That could indicate that there's a problem on the left side of your dog's brain, and something that could lead into seizures. And so if you're seeing that, so constant circling in one direction, they're becoming a little bit less interactive than normal. They seem to startle when you approach them from one side. Those are signs of a problem on one side of the brain, which can be something that can cause a seizure. So, for example, there might be a tumor on the left side of that dog's brain that is causing the dog to circle to the left. And eventually that tumor could lead to seizures.
Thank you, Susan.
Yeah.
Moving on with another one here. Knowing that seizures typically occur during sleep, can stress or high anxiety events trigger seizures?
Great question. So yes. So although most seizures occur while they're resting, the flip side with reflex seizures is that they can occur due to stressful events. And the most common stressors that cause seizures in dogs is trips to the vet. That's number one. Trips to the groomer is number two. Now, this is where cats and dogs are a little different, because there are other types of seizures that cats can develop called audiogenic seizures. And with these, certain noises can trigger a seizure in a cat. The ones that are most commonly observed are keys that are being clinked together, and then crinkling paper are two sounds that can trigger seizures in cats that have audiogenic seizures. But yes, really stressful events can certainly trigger seizures.
Another one here for you. If a dog hasn't had a seizure for a longer period of time, say 1 year plus, does it make sense to reduce phenobarbital dosage or even stop using it?
That is an excellent question. Yes and no. It depends. So what I will say is that that's a great question. That's one that's a decision to certainly make with your veterinarian's guidance. There's a trade-off, right? If we reduce the phenobarbital, we might see breakthrough seizures, but we might not. So if a patient has gone a year without a seizure, I will absolutely entertain weaning them off of their medication to see how they do, with the big caveat that they might go back to having seizures.
All right. Can you use CBD oils along with Keppra?
Can you? Yes. So as far as I know, I don't know of any studies directly investigating CBD oil and Keppra, but I know of a variety of patients who are receiving both and have no problems with it.
That's good.
Yeah.
Can seizures or the medications used to control them cause long-term behavioral changes or forgetfulness, such as no longer following commands or follows a command then forgets a few seconds later, things like that?
I definitely hear that a lot from clients who have dogs with seizures. So I would say either or could be contributing to it. The medications make them sleepy, and so they're just less responsive. And, I don't want to say they become lazy, because that's not it at all. But, I think it just takes them a little longer to process things. And is that from the medication? Is it from the seizures? The way to figure that out is to make adjustments to the medications. Oftentimes, if we have a patient who's just really no longer themselves, if we make some minor adjustments to their medications, we can get back some of their normal behaviors, maybe not all of them, but at least show some improvement in their, their liveliness. Yeah, liveliness.
That's good.
Did I answer all of that question?
I think so.
Okay.
We have another one here. Can a pre-ictal and post-ictal phase resemble head tumors?
Can a pre-ictal and post-ictal phase resemble head tumors? Yes. So I think the question there is, maybe I might take some liberties with this question. Dogs that have tumors, brain tumors, oftentimes will have very specific behaviors in their post-ictal period. The biggest thing is that after a seizure, dogs with brain tumors, let's say that the tumor's on the left side. Again, we're just going to pick on the left side. Let's say the tumor's on the left side. A patient who has a brain tumor and is having seizures from a brain tumor in their post-ictal period will often walk in circles to the left, even if they weren't walking in circles before the seizure. But after the seizure in their post-ictal period, they will walk towards the side that has the tumor. And so, yes, that might be a clue that there's a problem in the brain that's causing the seizures.
Of the medications you mentioned, are any of those cluster buster medications? How are those administered?
Great question. So cluster buster medications are they're given orally, so by mouth, and they're given to try to prevent additional seizures in a cluster event. Keppra is a cluster buster medication, and so I will use Keppra as a cluster buster in one of two ways. So let's say that a patient's already on Keppra as their long-term medication. If they have seizures while on their Keppra, I will double their Keppra dose for a period of 2 days. Very safe to do. If they're not on Keppra, then I'll just have them give Keppra for 2 days following a seizure. The other cluster buster medication that I use is clorazepate, and clorazepate is like Valium. It lasts a little longer, and it's an effective cluster buster medication too. I don't use it as a long-term medication because over time they can develop tolerance to it, so it stops working. And it also is really sedating. Clorazepate, just to put it kind of plainly, makes dogs just really clumsy, really derpy. They just get really tired. So it's not great, but it's quite effective at stopping seizures. A lot of people will try to use other formulations, other versions of Valium. So you you may have at some point, maybe you do this, or you've heard of people being sent home with injectable medications to give either into the nose, that's called intranasal, or into the rectum. So effective, but only for about an hour. And so if we have a dog who has a seizure, let's say at 10 o'clock in the morning, and let's say that that patient gets some Valium rectally, that Valium will help prevent seizures for about an hour. But then 2 o'clock in the afternoon, dog has another seizure because that Valium's, it's come and gone. And so the reason I use oral medications is because they last longer. And so I just don't find a whole lot of benefit to giving Valium to patients. The reason I will occasionally send it home is for dogs that have really prolonged violent seizures where I want to be stopping their seizure at home. Then sending something home to give either in the nose or rectally is a good idea because we want to be using that to stop the seizure, but they really are not great at preventing additional seizures. So I expanded that because a common question I get is how I treat seizures at home, and that answers a lot of it. So
that's good. Thank you.
Yeah.
Another one here is it possible for a dog to have both a movement disorder and seizures?
Oh, that is a great question. The answer is yes. Tricky. Absolutely yes. And in that case, we would say, well, we definitely want to treat the seizures. And maybe the movement disorder will respond to the seizure medication. But yes, they can have both.
All right, looking down the list here. Are seizures associated with canine cognitive disorder in older dogs?
Good question. No association.
Yeah, I like that.
Yeah.
If a pet is currently on a number of medications to treat seizures, will their body grow tolerant to any of those medications?
Very good question. Yes, it can definitely happen. The liver metabolizes many, but not all of these medications. And so over time, the liver can get really good at metabolizing them. The big one is phenobarbital. And so we will measure drug levels, and over time, on the same dose of medication, a patient might have a lower and lower level of circulating in the body phenobarbital, and that's because the liver's gotten better at metabolizing it. And usually all that means is that we need to adjust the medication dose.